Welcome, all new listeners, and welcome back to those who've heard my content in the past. If you're a physical therapist and you really want to maximize your outcomes and you are starting to see an interest in stem cell therapy and post rehabilitation, and you are looking for the next best answer on how to help your patients stay more active after these procedures, this episode is perfect for you. All right. Well, thank you for everyone for being here. For those of you who are not on YouTube watching this podcast, we have two amazing humans that are with me today. And thank you for the invitation. I have Scotty Nelson and Lola Dranker here. And I am here today really to get an understanding on how we can help the planet. How can we help the patients that come to see you after stem cell therapy? And ultimately, what is it that you want physical therapists all over the country and world to know? That is my goal today. So thank you guys for having me. I'm really excited to be part of this. I think we've worked with Scotty. When did we first see you?
It's been a few years.
Yeah.
Yeah, it's been a few years now. And it was right after. So I was the first person at the Cellular Performance Institute to get my discs injected. My business partner, Francisco, had already done something like 901. So I wasn't the guinea pig of the world by any means, but the first person at our hospital to get it done. And, after I got the procedure done, Francisco and my doctors had really encouraged me to get physical therapy. It was, I broke my back 2010. I got back surgery 2011. It was 2 years ago, almost 3 years ago now. So it was about 10, 11 years post surgery. My surgery was not what I would consider successful. When I got my surgery, they told me 3 months I'd be fine back and doing things. It took me 8 months to be able to walk. And then I did 2 years of physical therapy. I was a competitive jiu-jitsu fighter before then for many years. And so basically it took me almost 3 years to get back on the mat.
Wow.
And then that road was really, really painful. I ended up re-injuring my back actually down in Costa Rica at what is now Heroes, which was a nonprofit that Lola helped work with and create to get the local kids free jiu-jitsu. I was there with Rafael Lovato. Felt a click in my back. I could not walk for 8 days later, the trip back. And on that trip back, it was like, I have to give up jiu-jitsu. And it was super depressing for me. Fast forward about 5-6 years later, I got the stem cells. And now my back's like 100%. A lot awesome. Because of you guys, So I, with my schedule, it's hard for me to get into sports performance.
Yeah.
But, I was getting there once a week, once every 2 weeks with my back. And I just saw what you guys were doing. First of all, it's completely different than any other physical therapist I've ever been to, especially on the level of caring your team has, but on the improvement. Yeah. Like between each time I was going back, I was getting better and better.
It's amazing. And so that's been a few years now. And now, so if you were one of the first ones here at CPI to get stem cells and you've had the therapy, that was probably 3-4 years ago, and here you are today at a different level. You're seeing so many more patients with stem cells. How did you find your path into CPI in terms of now being part of growing this and helping people all over the world?
Sure. Well, I found my path in here because of my business partner, Ed Clay. I mean, the guy's just a genius. And he had an experience with blowing out his knees that led him to look into alternative stuff, something called Ibogaine, which is for opiate addiction. After he was able to basically fix that in a matter of days, his mother was actually in a really bad place because of rheumatoid arthritis. And the doctors had basically failed standard of care on her. Nothing had worked. And he found a treatment that was no longer legal in the United States that was available in Mexico. Chipsa Hospital had done a lot of that treatment. And that started on the process. It had actually closed. It had been closed at that time, I think, for about a year. Yeah. So he couldn't take his mom. So that started the process of, what eventually became buying and reopening the hospital, which it had been closed, I think, for about 18 months. His mom's name is Regina. She was the second patient that we had. She came in a wheelchair and she left shortly after walking. And she's been doing amazing ever since.
Wow.
That moved. Chipsa was originally a cancer hospital. So when we reopened it and brought the doctors back, they wanted to do cancer again. And we started working in cellular therapies for cancer. We always knew we could do regenerative medicine,
Yep.
but really that's quite frankly easy compared to cellular therapy for cancer. Cancer is the hardest one of them all. And so as we got the cancer program going and we're happy with results and growing that, we moved into the regenerative medicine.
Awesome.
It really only became the Cellular Performance Institute instead of CHIPSA because Google changed the rules on advertising stem cells, and they shut down our CHIPSA page, and we couldn't run ads for cancer or anything like that. They delisted us.
Yeah.
So we said we got to shift and create a whole new company.
Wow, that's amazing. So I know Scotty's story. Lola, it's great to have you on here. How are you part of this whole process?
Great to be here. I mean, that's also a long story, but I know Scotty and Ed from Jiu-Jitsu Mastermind. We were a part of a decade, maybe 11 years ago
I think it's
now.
longer than that now.
Yeah, maybe longer than that. And during the mastermind, around that time was when the guys got the hospital. And about a year after that, in early 2018, my dad was diagnosed with lung cancer in New York. So they gave him 2 weeks to live in New York. The tumor was 13 centimeters across his whole lung. It was in his hip bone, collarbone. And they said, look, we could try palliative chemo. And my dad was a Soviet guy. We're from Uzbekistan. So he was like, doctor is authority. Doctors are like, whatever they say goes. And I've been a holistic health coach for 12 years now. And he was like, I don't want any of your voodoo medicine. I'm going to do what the doctor says. So we went to Sloan Kettering. He got his chemo dose, Keytruda, and a platinum-based chemo, and in 3 days he couldn't walk. And it was just getting so bad that they wouldn't do the second chemo round. And I messaged Ed, and I was like, Ed, these are the records. And he said, I don't think you can get him here because how are you going to fly cross country? And he said, you just leave it up to the doctors. If our doctors can say that, that they can try, just bring him. And I brought him, and it was the most amazing thing that happened to my family. I'm getting a first podcast, and I'm going to cry. 2 weeks, his tumor is down 40% from all the amazing treatments we did at CHIPSA, which Gerson therapy, cellular therapies. He was one of the super responders to VG5000 and couple other things that we're doing, and it was just I got my dad back. He went from his deathbed to thriving. He went back to work full time, and then a year later he had a heart attack that he didn't survive, but he had an MRI the day before he passed. He had only scar tissue left in his lung.
That's
nothing
amazing.
else.
That's amazing.
So caught the heart issue. I always think that in an alternate universe he would have made it, but it was a year of another birthday, another Christmas, another
of course.
and every day is a gift, right? That's I think a lot of people just like with stem cells, they're looking for the cure. They're not thinking about the improvement in their quality of life, the improvement in if you're in pain 50% less of the time, less pain meds, that's an effect on your liver and your kidneys. You're saving a big part of your life, even though you're not 100% where you want to be. And with my dad, that even though he's not with us anymore, I got to meet all these amazing patients who got more life. Many of them are still in remission and did get the results that they were working hard for, and the doctors were working really hard for. And I, at some point, decided to move here, and the guys hired me, and it's all history from there. It's been a blessing. I'm very grateful every day to see the healing journey of thousands of people, and they're really humble, so they don't talk about it. So I will. So that's how I got here. It's through my dad.
You sucked her in.
And just seeing the facility and seeing you guys' team and culture, I understand that. Just being introduced to the doctors they were already firing questions and trying to figure out things. So they're very passionate. Clearly, you guys are passionate about what you do. And for those of you out there in the podcast listening to this, I've met both of these great human beings through probably one central source, probably Dominic Cruz, kind of centralized a lot of us, and I'm very grateful to be able to help him and everyone, the extended family, and be part of this. We started seeing patients, I think, through probably you were one of our first cases. We've seen PRP, we've seen a lot of regenerative medicine, but as we've seen more and more patients over the last few years, because our high focus on patient experience and outcomes, and we individualize things for people, every single person that comes in is much like you guys. Everybody has a story, and the reason why we care is because we're passionate about the outcomes. We understand that your dad is there. We understand that your back is debilitating. You don't have that function. That's a very big part of your life. That's like your independence, and nobody can strip that from you. And for us, that's a big factor on how we treat patients. We know that you just want to get back to doing something that you want to do, for walk, live a better quality of life, have another birthday, whatever it is. And so we get that. And so we're very passionate about it. And so as we saw patients post stem cell procedure, it just made sense. We just needed to figure out what the healing timelines were. This is a newer procedure. What changes with regenerative medicine? How does it affect healing rates? And then we just customized the treatment sessions. Now, the big reason why I wanted to have this podcast is because you guys are getting patients from all over the US, maybe even world.
All over the world. All
over the world. And he obviously said he's humble about it. So I'm glad. Yeah, that's fantastic. And there's a lot of physical therapists who have that passion to help people, just as we do. However, they're not familiar with seeing patients post stem cell procedure, and they are different. It's not a PRP injection. This is very, very different. The science behind it, the healing timelines, the progressions changes. So really my goal today is help the planet understand, if they see a patient post stem cell, what should they expect? What an ideal world would you want? What do you want them to know? What precautions are contraindications? How do we set up these people who are investing a lot of time, money, and energy and passion, and they're really, they have hope, and you don't want to crush that by doing something that was preventable, like being too aggressive or being too conservative. So, Scotty, I have a couple questions for you and Lola too. So, Scotty, can you tell me the science behind this? So as a therapist, at a basic level, what's happening post stem cells to help them understand now what's happening at the tissue level?
The answer to that question is no. I'm not a scientist. I won't even just try to go there and butcher it.
Yeah.
But I can tell you, the thing is that, especially Americans, like everybody wants everything to happen immediately. I got the stem cells. How come it hasn't grown back? It's been 30 minutes. But, one of the things that I've learned is, the stem cells, first they take time to kind of get accustomed to being, in the body. Yeah. And then tissue takes time to grow, especially cartilage, disc material. We do get people we call super responders, and their body really takes to them very well. They tend to be high-level athletes that break their body down a lot, and their body is used to be going through that phase, as opposed to somebody who is not, going to the gym every day is different than like what Dominic Cruz does.
Yes.
Right?
Yeah.
Let's be honest here. Are some of the other pro athletes that we get here. So it takes time for that tissue to grow. Then it takes time for that tissue to mature. Then it takes time for that tissue to strengthen. Yeah. And one of the biggest problems that we have is pain tends to go away pretty quickly, but that tissue hasn't had time to really mature and strengthen, so it's very fragile. We see it a lot. People start feeling great quickly, and they want to go right back into what they were doing, jiu-jitsu, weightlifting. Yep. These golf guys, my God, if you play golf, relax. It's not the end of the world. You want to go be swing. You just got your back injected, and in 3 weeks, you think you can go crack the ball for a drive as hard as you can again? You wouldn't be doing that if you had back surgery. So I honestly don't, I'm not a big science guy. I can't tell you the exact science behind what they are and how they work. I'm sure there's a YouTube video out there that could do a way better job. So I don't want to butcher it. So
Yeah.
I'm going to default a little bit on that question.
Yeah, and I appreciate this, guy. I think that the thing you're seeing is the volume of people. You're seeing the success stories. You're seeing the challenges. You're seeing people who don't do well, or the super people that you mentioned earlier. Now, you said something interesting that I really appreciate. That really challenges physical therapists. Our goal, we understand tissue healing. But here's the challenge that we have. We know that when somebody has surgery, an ACL or knee replacement, there is a scar, and we know there is healing in there, right? Then we know that that person is responding with, I'm in pain. I'm very hesitant to put weight on that, so I'm going to just be reserved about it. And we, as a physical therapist, we know that we can rehabilitate somebody. It's going to take 12 weeks to rehabilitate that. No matter what, it's going to be 12 weeks. Why? Because that's normal tissue healing repair. 6 weeks of inflammation, or 3 days of inflammation, 6 weeks of proliferative remodeling, and then going into a true remodeling phase. That's the basic science behind everything that happens when you have surgery. The difference between post-stem cell procedures and post-surgery is that there's no incision, there's no localized blown up tissue, typically, that is telling the person, ow, I'm in pain and I need this to heal. It's actually the opposite. No incision, and this person feels great within 3 days. That's a danger zone to physical therapists, because we're like, wait a minute, your symptoms are great. I can't see what's happening in the actual joint, so let's push you.
Yeah.
They think they're Incredible Hulk. And that's a lot of what we're seeing in the physical therapy world. I have people who call me who say, hey, Chris, I don't know what to do with these stem cells, because they're reporting 100%, 1 week in. And I'm saying, no, you treat it like a surgery. You treat it like 12 weeks of healing, no matter what. Even if they feel amazing, your job is to make sure that this tissue healing happens in the best possible way. And I think that's the hard part. They can't see the repair. They can't see the localized tissue. They don't see the incision site. And that's deceiving, because they're like, subjectively, symptomatically, they're like, I feel great. And for us as physical therapists, what do we do with a person who wants to be active, wants to go to golf? What do we say?
Push it.
Let's go. Let's party. And that's the danger zone. So all in all, there's several factors that you mentioned that I want to touch on. But the first one is they feel great, but they're not there yet inside that joint. And that, as a physical therapist, you have to keep in mind. And I'll review tissue healing timelines. But for you, the people who do best, these high active individuals, why do you think that they do better than other community members who are going to the gym 1 to 2 times a week?
Again, I don't know. My guess is you get somebody who's, breaking their body down every day in training. When I used to train, it was train till exhaustion and then push it. And the recovery time, you start learning your body, and you want to speed your recovery up. You're doing everything you can do to speed your recovery up. So I think anyone who's done that for years is listening to their body post stem cells, and they're implementing whatever worked in the past for them for that rest recovery period.
I understand.
So strictly a hypothesis, and it's not always those people that are super responders.
Yeah.
Super responder is just somebody who's the uptake of the stem cells, their body seems to process them and put them to work quicker. It tends, in my experience, I have no scientific data behind this whatsoever. I just try to meet every patient and listen to them.
Of course.
So all anecdotal.
Yeah.
My experience, it tends to be those types of people, but it's not always those people.
Yeah.
People that, I would say people that are saying they feel amazing in a week, that's a super responder, or it could even be placebo. Let's face it, how much tissue are you growing in 5-7 days? Not much. Now, inflammations can come way down.
Yes.
Especially people that do a lot of IV stem cells. I always tell my patients, if you can afford it, max your IV stem cell dosage out, because the positive side effects that we see from that, unintentional effects that people are getting, sometimes are like miracles. It's crazy.
So do you feel that you guys get better outcomes if you do IV stem cells versus locals? Oh, sorry, in addition to, not or. So if you do a local plus an IV stem cell?
In my opinion, and Lola talks to a lot more aftercare patients than I do, I don't think that you need to do a lot of IVs. I did 0 IV stem cells after I got my first back injection. At that time, we weren't producing the volume of stem cells that we do now. Now we're doing 7, 8, 9, 10 billion a week. So I didn't do any. I don't think that IV stem cells are going to change the effects of 20 million stem cells in your knees. Again, I don't have any scientific data. This is just in talking to people.
Yeah.
What I have noticed when I've done IV stem cells is that all of my joints feel better, less cracking, less popping.
Yep.
I'll get amassed few days of inflammation happen really to me in my wrist. One time I did break this wrist when I was a kid, but I hadn't really had problems with this wrist. But since then, after IV stem cells, I'm guessing around a month in, it just blew up, swelling and hurt like crazy. I hadn't done anything but type on a keyboard with it, and went away, started feeling a lot better. I noticed that it loosened up. My understanding is that the IV stem cells will go out through your body, and where they find inflammation, they can potentially start to heal. So there is like a real sense of wellness that grows, especially after the first month from doing the IV stem cells. Asthma patients that don't need inhalers anymore, diabetics that lower their insulin dose. We've gotten lots of great results with people with heart function, liver function, different things like that.
Wow.
And we kind of know why, but that's not what they came here to get treated. Yeah. And I'll always throw this out there. The brain is the most powerful drug of them all. If you think you're going to start feeling better, you're likely to start feeling better. So I won't come away from it saying that maybe it's placebo. Things that we've seen when people change their mind, and Lola teaches the Power of Mind class along with Sarah at the hospital. The effect from one day to another on the healing process of cancer patients when they can get their mind right, it is one of the most powerful things. So I don't know.
Yeah. And and I'll direct this to you, Lola, because if somebody has as a physical therapist, we're used to body regions, right? We treat the back, and then we treat the knee, and then we treat the shoulders and all these other things. And we're very segmented. Our profession is very segmented. It's just purely based on insurance. Insurance says, well, you can't treat the shoulder and the knee at the same time unless it's approved. So for us, we have to look at this. Now, when somebody has IV and a localized shoulder, we're now having a systemic response, but we've only gotten approval to treat the shoulder. So it does change our rehabilitation process. And I think, Lola, you have mentioned this to me before, where if you have people who have had an IV, stem cells via IV, it does change their immune response or their response with flare-ups or inflammation, not just at the localized site, but other things. And as a physical therapist, we're not used to that. We're like, hey, we're treating your shoulder. Why are these other joints being flared up? Can you speak to that? Like, what do you typically see in terms of what happens when you add the IV and the responses to it?
Yeah, I am also not a scientist or a doctor, but I have spoken to, I would say 90% of our patients that have completed treatment. I follow their aftercare process. And my understanding is from our doctors and scientists that we work with is as soon as the stem cells go into the bloodstream via IV, they work with your body's ecosystem. So they become, a lot of people think stem cells just turn magically instantly in 5-7 days into the tissue that you need, but it just simply doesn't work like that. Stem cells are responsible for a lot of signaling, right? So maybe there's things in your body that you already have to build tissue, but the signaling is off or the blood flow is not optimal. So when they get to that place and the signaling is right, you get more healing. Now, every person's different. Every person has different injuries, and I hear it all the time. Like Scott said, an injury that hasn't bothered a person for 20, 30 years. They just remember they had a car accident or something, hit their elbow, got IV stem cells. 3 weeks in, their elbow is swollen. And in a few weeks after that, they feel amazing because they had a response there. Does that happen for everybody? No.
But it can.
But it can. Yeah. So we see a lot of, it's kind of like a domino effect. One thing gets better, whether it's from a direct injection or IV cells, and then they stop overcompensating for an injured, joint, so their posture changes, or they start doing physical therapy, but then they might have pressure in another joint because they're altering their gait, and it's so complex.
Right.
And I think the key is, I hear your questions and where you're going with it, and I think the main challenge, I would say, is what you mentioned, is that there's no incision.
Right.
You can't. A lot of our patients argue with me on the phone and like try to get my permission to do stuff. Like, but what if I just go light on the bike after both knees, both ankles injected 2 weeks ago? And I'm like, I'm not your mom. I'm not gonna tell you no, you can't do that. But we recommend you go to physical therapy and make sure that all your muscles are firing properly, because you might have the inflammation and everything go down and you feel great. Now there might be space in the joint where there wasn't before, all these things. But you're still walking and moving as if you were injured, right? And you see a lot of that. You did that for me with running. So I see that all the time. And now I understand what kind of patient I was.
And I think, so both of you have a role that you see people pre or post, you see them through, and you help them kind of maximize their experience and maximize their outcomes. So from start to finish, I imagine you're in contact with them throughout that time period. And the doctors are obviously, they know the science behind it. They know all these other things. The challenge to the physical therapist is that, say for instance, they come here and a typical bout of treatment might be 1 to 5 days or 7 days. What is a normal?
5-6 days.
5-6 days, right? So they'll come here, they'll fly in from out of state, they stay here for the week, and then they fly back home. That's pretty common for people that you guys treat here. Now, they're gonna go and look for a physical therapist to help them recover with rehabilitation. Now, here comes the next challenge. A lot of these individuals aren't coming with a prescription from a doctor saying you have to, none of them are, right? So this is where physical therapy, that's the first barrier already for a physical therapist. If you work in an insurance hospital style system or outpatient where you're not used to seeing these people just straight off the street without a script, the first question you ask is, well, where's the script? What am I treating? And then what do I do with this? As a physical therapist, you should know what normal healing rates are, and it was done to a body region, so you know your timeline inherently. And I'll explain those timelines so you guys understand a little bit more. But these people are stuck not knowing what to do next, these physical therapists. And now the patient's like, well, I was informed that I could now start to work with this patient, but I don't know what to do because it's been so many weeks or so many months. My goal is to outline what normal tissue healing guidelines are, have an understanding to everyone else out there that in an ideal scenario, what would you do with these healing rates and what would you do with rehabilitation? It's not that hard. So let me outline just a little bit and you guys can see where your patients struggle, which weeks or which months. And it's great to hear your input because you see maybe the before, maybe the after, or the results afterwards. So let me outline this healing rates. All right. In the first 72 hours of any trauma, an injection, whatever it is, it's the inflammatory state. This is where your knee balloons up. It's purple, it's blue, it's green, it's all the above. After that inflammatory state, right around day 6 or day 7, it starts another phase called proliferative phase. Proliferative phase basically means all these good healing cells are starting to work over time. You have repair cells coming in, and proliferative phase is from day 6 to about day 35. Okay, so you're getting into the 5-week mark. Okay, so from there, at this point, that's why they say the first phase is 4 to 6 weeks. That's very common for anything post-surgical. After that, you have a remodeling phase, which is day 35 forever. So most people post-surgery or post-injury flare up in the first 6 weeks. Why? Because they're now having all of these cells coming into them. As a physical therapist, we know that because after surgery, in 2 weeks after a surgery, they're gonna come and remove sutures from you, right? All the stitches are gone. That's a normal process at the 2-week mark. After that, at 6 weeks is when we can start to push you a little bit more. Now we can start to add a little bit more strengthening. Then after 6 weeks, it's another 6-week mark. So basically at 2 weeks, we know that's a normal healing rate. At 6 weeks, that's stage 1. 6 weeks to 12 weeks is stage 2. And then at stage 2 is 12 weeks. That's when people can start to run, jump, start to go back to sport. So normal healing rates post-surgery, 12 weeks is the minimum before you can add that stress, going back to sport, jujitsu, those type of things. So if I had you post stem cells, I would have been stretching you, getting you stable, good balance for the first 6 weeks, but I wouldn't have had any load on you until week 6. Why? Because I have to have those cells repairing. Then I get 6 weeks to get you stronger. And then at week 12, then I get to introduce you into any form of training that you would do. Now that's a conservative approach. Everywhere inside there, if I have a Dominic Cruz or somebody pro fighter, I'm probably going to play with the timelines a little bit more, but I have to respect healing. I have to, no matter how good you feel. And you say, Chris, I want to roll tomorrow. Come on, just a little bit. Like, I won't do anything on the mat. It'll be standing the whole time. I know what happens. I give you a little bit, I give you an inch, you'll take a foot. For me, if I know that 12 weeks is normal, every physical therapist should take that same approach. The only thing I've heard talking to the doctors here is that the IV stem cells just change that a little bit more. And Lola, I've talked to you about this. And I think physical therapists out there, if you're like, hey, Chris, how do I work with these post-stem cell patients? It's no different than your 12-week timeline. It's no different than a normal 12-week timeline. And after talking to the doctors, that's exactly what they said. They're like, an ideal world, you're just understanding it's going to be 12 weeks to get these people better. Now, there's always cases of super healers and people who don't have the best outcomes. We get that. But inside 12 weeks, you're doing nothing different than if it was a post-surgical case and you're progressing them through that. Now, the thing that happens there is the IV. Lola, in your experience and what people have done, after talking to the docs, they said those first 2 weeks they do change because people have immune responses. What has been your experience with people who get the IV stem cells?
I would say that after the first couple of weeks, people can get back to their normal life generally. Mm-hmm. But we just never know those old injuries that they don't even remember about.
Like his wrist,
respond. Yeah. Exactly. Like there's no way for us to predict that your wrist was going to have that response. But generally those flare-ups don't last more than a few days to a week.
Yeah.
And we just advise people that when they have a flare-up, reach out. We have an aftercare doctor, medical team that gets in touch with people and kind of guides them through that.
Yeah. And so that's important to know. So, but what you don't want, and I imagine this can happen, is if the physical therapist or anybody helping with the rehabilitation, if they don't know what to do, they're just going to keep directing the patient to you. And you're like, we can only do so much remotely. Mm-hmm. There's clinicians who know what they can do. The problem is it's a new procedure. They're scared to mess it up. Obviously, they don't want to. Yeah. They don't want to do anything wrong. Our goal is to educate them so that they have the normal standards and they can actually work with these patients on their own without having to call you for every question. That to me would give them so much more power and give the patient so much more independence without having to rely on you guys calling you every single day. I imagine there's some people
I can't imagine a world.
So, all right. So
you'd be surprised the calls we get sometimes.
So,
I stubbed my toe. Is it going to ruin my stem cells?
Okay. Yeah. So to lighten your load and help clinicians, because the biggest thing that they don't know is what's happening. Why is this different than any other procedure I've ever done? And if they have a flare-up at their wrist, but I'm treating their knee, what do I do? Is this a negative side effect? That's the biggest concern. Honestly, that's all they're caring about. But if they understand that with IV stem cells, that they could have responses all over the body that have maybe nothing to do with the localized site, that's a big one for them to know, that there is some normalcy inside that. After talking to the docs, I heard 2 weeks is a good time frame where they might have immune responses to these IV stem cells. So if that were the case, all I would do is push the 12 weeks of recovery, shift it plus 2 weeks, basically. So it wouldn't be 12 weeks, it'd be 14 weeks if they get IV stem cells. That's the only thing I would change inside this. So now you have a 14-week recovery with IV stem cells, but if you don't and you just have localized, it's going to be the normal 12. That is probably one of the biggest takeaways that I took after talking to the docs. That was so helpful to understand. Patients will have immune responses. That's very normal. And it might not be at it might not be at the localized site. That's important to know. From your guys' response, you're a patient advocate. You see them throughout this whole process. You might see them in pre-post. What are the things that they struggle with that you wish that physical therapists or healthcare providers would know about this procedure to help the patient outcomes? What are some
Can we
things?
back up one before
Yeah.
that? The first real question is, how do I pick a physical therapist?
Ooh.
Mm-hmm.
Oh.
Yeah.
Just go on Google and type in physical therapy.
Oh, that's a phenomenal question. I was not ready for that, Scotty, and I appreciate that. All right. So 100%, you're going to go on Google and you're going to say physical therapist, and then you're going to look at Google reviews. And the problem is it's associated with a clinic, right? So a clinic will say 300 5-star reviews. And you can go through all those things and you're going to look for the person who's been mentioned the most. That's probably what people are going to do naturally, right? There are some credentials that help you as a consumer understand qualifications. So we all know that if you have more certifications, that person is hungry for education. They want more. It doesn't always mean that their care is going to be better. So it's hard to present that. Okay. So the first thing I would do is look for people who have certain credentials. Is one of them. This is a good starting point. You can do the Google reviews. Perfect. You've locked it into the top 5 clinics that you like in Indianapolis, Indiana. Perfect. Then you're looking for some credentials. There are some credentials that are highly respected in our profession. An OCS, orthopedic clinical specialist, is a very tough exam to do. Not everybody has it. A sports clinical specialist, an SCS. These tell you that they are progressive. Then you might have some strength and conditioning certifications like a CSCS. This person likes working with athletes or active people. From there, then you can read on their bios, what is this person, what type of training has this person had? Have they done a residency? That's a big one. Not everybody does a residency. In medicine in the US, all physicians have to go through residency. Some do fellowships. In the US now, only a certain proportion of physical therapists go through residencies. At the time I did mine in 2008 and 2009, I was one of 5 people in the US who did a residency.
Wow.
That explains why you're so good.
Yeah.
I appreciate that, Scotty. But what you really understand, this is the hard part of healthcare. I care about what I do, right? Like I'm obsessively passionate about humans, right? I asked you earlier before the podcast, I was like, hey, where are you from? And you said, that's a hard question. It's a hard question. And ultimately what you really understood was you just got to know who people are, why they make their decisions, and who they are. You can figure that out upon meeting somebody. You can read that person. To me, that's my passion. So when I have patients in front of me, I'm a gypsy too, so I get that. So I just need to know, what is it you're looking for? I'm going to help you attack that. I don't care that you stub your toe. I respect that. But what do you want to do? You want to roll? Perfect. How far out can I get you to be patient with me? 12 weeks. Can you wait for me for 12 weeks? All right, you're willing to do that with me? Let's barter. Let's bargain. I understand your goals as a human. I get that. You want to run, Lola. I understand that. And most physical therapists, they just want to change the knee range of motion. They want to get more flexible. And the concept of getting the human to where they want in a time that they want is foreign to people. That's the only reason why I love what I do. And every member of my team has that same vision. Now, every healthcare provider doesn't have that. That's the challenge. So I can't tell you that. You're going to have to stumble upon that. But what you're going to do is you're going to go on Google. I appreciate that. Go for the reviews. You're going to look for people who with higher level credentials. Doesn't mean if they don't, they're not good. I'm just telling you how do you kind of filter a little bit more. And then you look for their bios and see if they've done a residency, a fellowship, and that they've gone beyond the baseline level of education. That's probably what you would do for a dentist. You're looking for like somebody who is highly qualified, has done this before and works with active people. That's probably what you're searching for, because the people that you see want to be more active, or else they wouldn't have this, right? They're currently debilitated.
Sure.
And they want to be more active than they currently are. So for me, those would be my 3 standards to help you choose a physical therapist. What has worked for you guys in the past? What's been the algorithm that you guys do?
I hate Yelp, so I tell people to go on Yelp and look for people that have a lot of good reviews. The first thing I always do is just ask for personal referrals. Like just ask.
I get that.
A lot of the people that we get, not everybody, but a lot of the people that we get down here are athletes in some way or another. But I would say most of them that are getting treated, obviously, for musculoskeletal stuff are active people.
Yeah.
And so the first place I say is, go ask around at your gym, ask around on the golf course, ask around, find somebody who's happy with the person that they went to. The other thing I've heard from a lot of patients is that, two different things. One, if you call your PC and you say, "Oh, doc, the pain, my shoulder," you can probably get your insurance company to pay for your physical therapy. However, I've heard from other patients that if they go through their primary care, kind of like what you said, like, well, I got 3 places injected. They want me to come back 3 times a week. That's how the insurance system. People complain about big pharma, but you should complain about big insurance. They control more of our healthcare than pharma ever does. And so they find it's more valuable to just go in and say, I don't have insurance, and cash pay.
Boom.
It's usually cheaper, and they can get everything they want done in one session.
That is a big thing for patients to do. And physical therapists, believe it or not, we're just not used to that. We're not used to a cash pay person coming in and saying, hey, I would like to direct my care and have you help me alongside that. The physical therapist is usually whatever the primary or the ortho says, this is what we're supposed to do. Here are the 5 things you can touch. And here's the 6 sessions you're allowed. So it's very boxy. In this scenario, patients, it could be their back, their neck. They had 6 injections in their neck, 4 at their low back, and 2 at their big toe. And now you have to be able to get that, and they want to be able to roll in 6 weeks or 12 weeks. What do you do with that? Well, it's just an equation. It's 12 weeks. Let's figure this out. We'll do it all. But physical therapists were used to segment it. I can only touch the neck for 6 weeks. I can only touch the back for 4 weeks. And I only got 8 sessions for the toe. Sometimes it is better for these patients to pay cash pay. Why? They're already investing a lot of time and money to come down here. And I don't know what your guys' ratio is. What ratio would you say, how important is the procedure and how important is the rehab afterwards? What percentages would you say?
Both. You can.
Like 50-50, like 60-30, 60-40?
Lola talked to this too, but when patients come in to me, especially with like shoulders or knee stability, and they're unhappy with their results, I'll say, because I don't want to say like, hey, did you do physical therapy? I'll say, what did your physical therapist have you do?
Fair. You've already assumed. Look at that.
And they'll go,
I love that. I love that one.
Physical therapist. And I'll say, if it's a shoulder, I'll say, so are you a side sleeper? Yeah. And they'll go, yep. And I go, oh, well, you're never going to get out of pain until you go to a physical therapist. So
that's fair.
Even if the stem cells completely reattach your rotator cuff, if you're, not doing something to realign your shoulder, you're never going to get out of pain. Yeah.
And then another patient favorite is I'll be the, did you do physical therapy? And they'll be like, oh yeah, I do physical therapy in my garage all the time. Oof. And that, I already know why they're in pain, what they did. And I can, I fill in the blanks and then I just follow up with the doctors after. And when they re-injure or re-flare up or hurt themselves, it's because they were trying to do something that they did post their injury before that they think they remember the proper way the physical therapist showed them, which I have to have you remind me after 25 visits what we did last time.
Of course.
You're like, you're doing it wrong.
You're human.
Yeah. And patients try to do that. And a lot of times, like, we do put a huge emphasis on physical therapy just for them to find one and do it and commit to it. But people create their own interpretations of what that means, and a lot of times get themselves in trouble. Yeah. But the people who do follow through aftercare instructions and have a great physical therapy partner, we tend to see that those people do better long term and don't re-injure themselves and give themselves time to heal properly and strengthen all the tissue around the area that got injected. Because I know that the doctors also are always concerned about preserving muscle tone. Yes, and that's like a big thing after surgeries. But after surgery, you're laid up, you're doing nothing because you can't put weight on. Like if you get a knee surgery, you're in a boot and on crutches, and it's a different process.
Right. And
that's an interesting one I'll comment on is that we hear from patients that their physical therapists say, oh, you're going to lose muscle mass if you don't hurry up and start doing something. I can tell you we've had CrossFitters, power lifter guys that come down here to do IV stem cells. And when you have all those stem cells in you, that mass is going to come back a lot quicker than it did before you had 150 extra million stem cells running through you.
Yeah. And I think the fear of the muscle mass is because we're not used to these cells that help angiogenesis, these cells that help you promote cellular growth and activity. We're not used to that. We're used to something's been carved out of your bone and now you have inflammation, but you don't have these cells that are actually helping growth factors. So for us, that's the barrier. It's almost like we wish that they were in the boot because now they actually, you know what I mean? Like, it's so crazy because you guys are doing a procedure that's non-invasive, non-operative, that mimics recovery operative, which is that is the biggest thing that physical therapists need to understand. Your question, I really appreciate your question. How do you find the best physical therapist? Anytime Lola asks me, hey, who do you know in Silicon Valley? Who do you know in Austin, Texas? That's the first things I'm going to do. Now I'm a physical therapist, so I can read through a lot of the jargon. I can read through a lot of those things and I can see the bio. And then I'll do a couple phone calls and texts and being like, hey, I have a network. Here's my 50 studs all over the US. So I can help with that. I get that. But obviously that no one has that time. So we're trying to create a resource for physical therapists who are interested and knowledgeable in treating these individuals, that we can create almost like a Google map, and you have like a really easy place to identify, well, if somebody's in Minneapolis and somebody's in Florida, these are your kind of your go-tos. So that's currently what I'm working on at the moment to help you guys with this. Obviously, for me, I'm passionate about physical therapists who want to be above the baseline level of care. And it's really unfortunate in this planet, there's people who do the bare minimum. And the people who listen to this podcast, you're clearly wanting to do something more. And so if you want to be on that list and you want to be able to see, patients with post stem cells, and you want to help people get back to rolling, get back to running, and you're not scared of treating these people, you're not timid when it comes to doing these things, send me an email, send me a direct message. I'd love to be part of this. Going back to the question, what is the biggest challenge you guys see with people going back to physical therapy? You found a good physical therapist. What are the challenges that you guys are seeing for the first 12 weeks?
It's twofold. One side is, somebody's been in pain for 10, 15, 20 years, and suddenly they're not.
Yes.
So there's this really, really impatient period of time where
golfers,
they understand, they appreciate the result. They're like, I feel so good, and they're doing physical therapy and they're not having flare-ups and they're not in pain, and they really try to rush that 12, 14-week timeline because they're trying to make up for lost time, especially the people who get rid of nerve pain. Yeah. Those are the ones that are like, they've been on pain meds for a decade. Yeah. We have people who weren't able to feel because of really bad pinched nerves or sciatica and stuff, weren't able to feel or move their toes, and now they can, so they want to do all the things, and slowing people down, because not only is the patient impatient, but a physical therapist can, get a little ego involved. Like, look, I'm doing so well. I'm pushing you. You're improving. Yeah. So there's that twofold. So that's one challenge, is that the super responders are people who are just out of pain and want to get back to life. And this is why they did this. Yes. And then there are people who are slower in the recovery timeline. And have a lot of inflammation. Yeah. And when we work, especially with shoulders, really banged up shoulders, we have people after multiple surgeries, and that takes time. Yeah. And they're impatient with the physical therapy because they'll do a little bit and then they have a flare up because there's so much stuff happening there. And the injury is just, some people take a longer time to heal. Somebody might at 4 weeks be pain-free. Somebody might take the full 14 weeks to get to that point where they have, inflammation come down and their range of motion is back. So just understanding where you're at in the healing timeline, where you were in your injury timeline, and respecting that, and just patience on both sides of the spectrum. You know, softer tissue usually grows faster, and
like,
harder
yeah,
tissue, cartilage, bone will take a long time. And just people respecting that timeline is really difficult to communicate. So when they do go to physical therapy and the physical therapist is not respecting the timeline or appreciating how the healing process works, it feels very conflicting sometimes. I feel like it's not supportive to the patient if a physical therapist is like, well, you should be able to do this
I like
by
the voice.
6
That was pretty
weeks.
good. Yeah, that's good.
I try.
No, and I appreciate that. The thing I'm taking from this is, as a physical therapist, let's assume that they're gonna heal in 12 to 14 weeks. That's gonna be the healing rate. So if they feel good in between there, it's okay. No need to try and put them into like a super healer phase. Just respect the timeline, get them to the 14, and play it safe. Because this is a procedure you don't want to do multiple times if you could have done it right from the beginning.
Exactly.
Yeah, you can have touch-ups, tune-ups, whatever it is that they come in, a couple times, or I don't know if you have people who come in for multiple injections over 1, 2, 3 years.
We do. Most of our patients could and are one and done.
Okay.
The thing is our goal is to get these stem cells FDA approved.
Yes.
I need data to do that.
I see.
So when we first started out, somebody that was doing well or somebody that wasn't, either way, begging them to come back to Tijuana for no real benefit of their own didn't work.
Got it.
So we had to develop what we call an ethical bribe. Say, you come back, I'll pay for your MRIs.
Fair. I see. You
and
need
I'll
the data.
give you $10,000 in free stem cells.
Yeah.
So not good for my short-term margins
but you need data
by any means.
Yeah. Yeah.
Especially when we have an MRI machine shortage down here in Tijuana. But the data is fantastic to get all of that data. And sure, the people that are doing well is great. And I love that they're doing well. But when patients aren't doing well and getting to figure out why, that's where the real value is. And that's where, in my experience, the people I talk to, if there are people that do great that don't do any physical therapy.
Wow.
The people who aren't doing as well as they'd like, they might have like a lot of improvement and everything like that. But, like I said, shoulder pain is a huge one. Knee stability. Like, hey, I have no pain in my knee, but it still feels weak. I can almost guarantee you every time they did no physical therapy.
I got it. So they went for the subjective response. They're like, hey, I feel great. So they went off of that.
Which is crazy, too. If you had knee surgery, how would you
that's what
expect
I'm
to even
saying.
be
It's
walking
almost
again
better.
if you didn't do physical therapy?
I say you guys just put a little incision so that way it's a little friendly
Get a little
reminder.
tattoo.
Yeah.
Well, one thing I was going to mention is I always encourage our patients to bring their radiologist report, if not the MRI film there. They know where they got injected.
Yeah.
They can point it out. Now, all of my MRIs are in Spanish. Guess what country we're in? It's another thing. Hello, Americans. Guess what? Not everywhere in the world is English as the first language. I know some of you never travel out of the country. You're clueless about things like this. But we have this thing called ChatGPT where you can take a picture of your MRI and it will translate it all for you. End of public service announcement.
Tell them, Scotty. I appreciate this.
You know how many times a week I have to say that.
Man, that should be part of like your post, your discharge packet. Like, literally,
it is.
Screenshot ChatGPT, enter, copy, paste, read, report, completed.
Well, find me a good health facility that isn't full of Latinos, anyways. Come on, son. You know what I mean? The most caring ethnic people I've ever met.
Fair.
There's somebody that speaks Spanish wherever you go in any health industry in this country.
So that it's a thing that PTs run into, right? So it's obviously in Spanish. So like, I'm in the middle of nowhere, Alabama. What do I do with this? So ChatGPT, great, we got that. For you, when you have these people who are flying from in and then they're coming out, what are you using as your data besides subjective? Like, I feel better. Obviously, FDA will have a challenge with just a report of 0 to 10 pain, and
actually they like that.
Oh, really?
And we have an automated survey system that goes out where they starts out weekly and then it goes to monthly.
Okay.
And then we have a series of MRIs depending upon, so I can't do this forever. So each month we kind of look at how many people, Because you know what? People that live far away that feel great,
Yeah.
they don't give a rat's
They're out.
ass
They're
how
done.
much you're giving them. They're
Yeah.
not coming back. Right?
Yeah, I get that.
So, and that's okay. You know what I mean? I want the data,
right.
but that's okay. So, each month we kind of take a look at it and see, okay, how much more data do we need to collect? So we did only 3 months for a long time.
Yep.
But then we started after the 3 months having patients return 6, 8 months, a year later that just wanted to come back for treatment. A lot of times people just want to come back for IV or they hurt something else. Wow. And these are paying patients. And they would come and I'd say, hey, yeah, let me get an MRI. I'll pay for it.
There we go.
Okay. Okay. And then we're looking at it and we're seeing, man, this guy's, just like mine.
Yeah.
If you go on, it's on my Instagram. If you go on my Instagram, you'll see that even though 90 days after my stem cell procedure, I have an MRI there the week before, 90 days out and 1 year out.
Yep.
At the 90-day mark, completely out of sciatic pain for the first time in a decade. Like I can do anything. Run up and down stairs. I couldn't walk up and down stairs before. And but the improvement in the discs, there was some, looked a little bit better.
Sure.
A year later, they don't even look like the same discs. Dr. Vallejo, our interventional radiologist here, was like, Scott, if I didn't know you personally, there is no way you could convince me the before and after MRIs were the same person. So as we started to see that, we said, hey, and we saw mine, let's get more data. And so right now we're actually doing 2 free returns, $20,000 plus all free MRIs
to get the data.
To get this data.
I appreciate that.
And we're seeing more and more that with our type of hypoxic stem cell, low oxygen stem cell, that these cells are living for a long time in people. I wouldn't be surprised as after we finish getting all of our year data, we start inviting people back at 18 months or 2 years.
Because you want to see where the peak is. Because you don't right now that the 1 year is kind of a peak, but you don't know if that's going to continue.
We've had patients that felt nothing for 3-4 months, and then in month 6 or 8 they call us up and they're like, "Oh my God, I feel fantastic."
You need more data. I understand. I see.
And no one's collecting data like this. There's a lot of really good stem cell places out there.
Yeah.
But you have to really be willing to take a bite in your bottom line.
I understand.
To collect data like this. And to me, it's like you honestly have to care.
It's a long game. Yeah, of course.
Creating the long-term, the best experience possible for the patients. And, data is valuable too, but it's not cash in your business. Sure, in 5 years worth of having all that data, we can move forward with the FDA. And if these become approved with the FDA, with the patents that we hold, that's a lot of money.
Right.
But you gotta stay in business all that time before you get to that payout, and that payout may never come.
Yeah, I understand. So you have a risk there. Yeah.
Sure.
So obviously doing MRIs, we talked about CT scans. There's another option. But MRIs right now, you're going to be your standard to look at what does that look like pre and post.
Correct.
That's your ultimate goal.
And of course, it has to be on the same MRI machine with the same radiologist to be accepted into a study.
Wow.
Because people always say, why can't I get an MRI back home and send it to you? I'm like, if the FDA would let you do it, it's a lot easier for me. But it doesn't work like that. You know?
Appreciate our accents and tone change.
I can't imagine what your office is like. I love this because I get it. I understand. A couple more questions. One, do you see something that can help facilitate or supercharge this person's healing and minimize their risk of flare-ups? What would that be inside their first 6 or 12 months? What do you hear that, if done, will help minimize or improve their outcomes with a reduction of an injury or a flare-up? What would that one thing be?
What do you hear, Lola? Then I'll tell them.
The biggest one is not having a physical therapist give them weights at 4 weeks.
Oh, really? Really?
Yeah.
I would have never guessed that.
You're doing great. Let's start weights 4 to 6 weeks.
I see they're not ready yet because they haven't hit that marker. Now, if it normally was 6, now they're pushing out to 8 because of the 2 weeks IV. So they have a month more to go. So they push them early. Yeah,
because if there's no flare up, they could have stayed the path and not had a flare up. Stayed the course. I'll give you an example. My mom tore her meniscus in June of 2022. So almost a year and a half ago. She was so scared of surgery. We went to Mount Sinai in New York. They were like 100% you need surgery. At that time she was 65. they're like, you need surgery. You're not going to recover on your own. You don't work out. You're not an athlete. Her knee ballooned like to 3 times the size. And she had a cyst. So after 3 months of trying to convince her to do stem cells, she finally caved. I brought her down. They drained the cyst, put the stem cells in, and then I had her on proper physical therapy protocol in New York. An amazing doctor, Dr. Stern. And he kept her on that timeline.
Yeah.
And
Just follow the path.
she had 0 flare-ups.
Yeah. Yeah.
She didn't overdo it. We have stairs in the house. I didn't let her go up and down the stairs all the time like she would with a laundry basket, which is weight, right? So people don't think about the household daily
stresses,
things that they do, which put stress on the area. Yeah. She had 0 flare-up. We got MRI, did her 12-month follow-up this past few months ago, and her meniscus is 80% healed. Like there's one little patch left. She's 67 now, and at that she's not an athlete, but she is a super responder because she would like really follow
the path,
the path. And does that mean that every person who's going to follow the aftercare to a T is going to respond the same? No. Yeah. But do you have higher chances of having a good response if you're not aggravating that area over and over? Yeah. Yeah.
So you would say just follow the path. Don't push too hard, even if they feel good. That's really, especially at that early mark, that 4 to 6 week mark.
Yeah, just patience. And like our golfers, like we could say it over and over again, but it really comes back to the same thing. Be smart, listen to your body, and you know, it's a lot of money. Protect your investment.
Yeah, of course. Like that's the biggest thing. That's real.
No.
Sky, what would you say?
You know, I would say it's not people not listening to their bodies, and many of the people think they're going to get the flare up in the instant of when they're exercising and they're doing something.
Yeah, I see.
And frequently it comes in the middle of the night.
Interesting.
And so, you know, I always tell patients when I talk to them, I said, if you start feeling the least bit of uncomfortable or pain, say you're walking a mile, you know, that's what you're doing to stay active. And at a half a mile point, you're like, oh, my knee feels a little bit weird. Walk home. You know,
sure.
If you wait till you actually feel some pain or starts feeling a little swelling, you're going to be hurting. You're going to have a bad flare up. But I think people think that it's going to happen in the instant of that. You know, I think, you know, your body's doing some healing while you're sleeping, and that's why it comes about when that's happening. Also, the pain that's caused by flare-ups is bad. The immune response that's caused by it is just kicking in your immune system. Right. So it can advance the healing process if it's not overdone, right? Frequently with runners, I try to explain to them, if you're trying to grow cartilage back and you want to hurry up and go run again, the same thing that pounded the cartilage out, that brand new baby cartilage isn't going to last. Right. So you might need to do something different than trying to run 5 miles a day. Right.
But that's what they're used to. Because that's
I get it, yeah.
And in their head, they have an expectation. I imagine you're just managing people's expectation all day.
That's all we're doing.
Yes.
That's literally it, right?
All we do is manage
and okay, so you guys come to our clinic. We're going to do the same thing because you're like, hey, I want to run a marathon in 3 months. And we're like, ooh, I love that you feel that way. But there's some things we got to do to make sure. If you're like, hey, I want to roll. Your calves don't agree. Yeah, your calves don't agree with it. Your hips don't agree with that. And you're like, hey, Chris, I want to roll in 6 months and my back is thrashed or whatever it is. It's now we have to match expectations. Being like, that's possible, but that means you have to have 0 flare-ups for the next 6 months. Now, that's not my job. That's your job, because now you have to manage stress outside of me. And that the problem becomes physical therapists, we're not used to, our profession is based on progressing stress. You guys, like, that is our job. If you're weak, we get you strong. Our goal is to take you from here and up. We're not used to keeping you at bay. Meaning, if you're healing, our job has always been, well, let's get you stronger. Let's get you more mobile. Let's get more flexible. And what this procedure you're saying is, you're actually not progressing. You're keeping them at bay with good stability, working on things, but you cannot add stress or load early, because if you do, you're going to flare them up. And our profession is based on adding stress to create change and metabolic and physical changes. That's why this procedure is foreign to us, because you guys are saying, don't add stress until week 4, 6, or 8, whatever that marker is, because these things are healing. Well, the patient is coming in saying, expectations are, I'm going to be running soon because I now have new baby cartilage in my knee and I'm ready to run a marathon. Physical therapist says, I've never seen this procedure. Let's add more stress because I want you to look good. So we just keep adding stress. So the patient's expectation, the PT expectation is, let's add stress. And yours is,
and then rip.
there we go. So that's where this is all going haywire. Your expectation and the doctor's expectation of what healing should be is, don't mess this up for 12 weeks. It's a brand new procedure. You let it sit, you let it bake, you let it marinate, and you just let it cook for 12 weeks. Physical therapist is like, well, what am I going to do for 12 weeks? They're just sitting twiddling their thumbs, and patients, I want to golf. I want to golf. But
I feel great.
Yeah.
Why can't I?
So you're basically buying time for the first 6 to 8. Then you get to load them at the 6 to 8 week mark, and then you get to have fun. But most patients, even if you tell them that, they didn't hear it.
Oh no, they don't hear anything.
They might be.
I say 1 month. They all they heard. I say 3 months. They heard one.
Did you say tomorrow? Did you say tomorrow? Is that what you said right there? Yeah. So our job is to provide a roadmap or an outline for patients. But knowing what you want, we can deliver on that. We're just not used to it, and that's really why I wanted to bring you guys on here. And like, if you can talk and speak to a physical therapist after you've been Googled, Yelped, and word of mouth, they searched you out, and you're going to be the physical therapist. You've earned the honor to work with this patient post stem cell, and especially if it's your first one, you're gonna want to be a superhero. I know you. Every physical therapist at a certain level, they're type A, OCD. They're very, very good academically, and in the clinic, they're great human beings. They're type A drivers. They're good at what they do, so they don't want to be wrong. So what they're going to do, they're going to flare them up because they don't intend to, right? This is physical therapists that you guys see. They're like studs. They want to be good at what they do. They're just not used to, hold on, yellow light, we're just going to cruise for the next 6 to 8 weeks. They're not used to that. And so those who are listening to this, if you can understand it at the grand scheme, your job is not to mess them up for the first 6 to 8 weeks. Add the load at 6 to 8. At 12, you can have the discussion of going back to the gym or rolling or whatever it is, but you're not doing anything inside that. Then what we don't know is, where is the peak of their healing? Is it 6 months? Is it 8 months? Is it 1 year? Or could it be 18 or 24? We don't know that yet. So just know this is not a PRP injection. This is not a post-surgical procedure. This is a stem cell that is healing and growing, and they need time on their hands with a little bit of stress that's fine-tuned. And if they flare up, it's okay. Bring them back down. You don't have to call the patient advocate every single 30 seconds if they stub their toe. Just know this is a long journey with immune and localized flare-ups, and that's a normal part of the process. That to me is really what I wanted to accomplish, to have you guys on this podcast to share your knowledge. You guys are doing amazing things, and there's physical therapists out there who can benefit from it, and really just wanted to share that with the world. So I appreciate you guys having me on here. If a physical therapist had questions, I'd love for them to reach out, whether you're listening to this on YouTube or Spotify or whatever it is. I'll have a link to having a direct call with me if you guys need any help or support. I'm happy to help any patients that you guys have. Ultimately, we have a network of patients who need the help, and we're trying to create a network of people who want to be able to be part of this, to help people like yourself, broken back to knees and all these other things. We appreciate the stories, and that's what we want to do. And if these patients, or excuse me, if these physical therapists had any questions about the procedures, where can they find you? How do they find you guys?
First of all, Dr. Chris, slow your horses, buddy.
Look at them.
I'm seeing 35, 40 patients a week. I was planning on sharing this podcast with every one of them. I think you probably have your own patients that you want to deal with. You don't seem to understand how the phones blow up here at Cellular Performance Institute. So I would say to stem cell patients, listen to the doctor here. This is the best physical therapy I've ever had. I feel this way all over the place. You guys are great. I'm 2+ years out. I still get in there every time. I'm part of your subscription package. I send everybody. I say, hey, you live in SoCal? They got 2 locations. Go to sports.
3 now.
3 locations. Oh, where's the third one?
Kearney Mesa.
Yeah, even better for the OC people. Okay, good. I thank you. I'm gonna have to let people know about all 3 of them now. But just listen to what he said. Even if you feel like your physical, I get it. You want to get better, faster, quicker.
Yeah.
But listening to what Dr. Chris just said for that first 12-week period, listen to what you're saying and listen to your body. Even if all of a sudden your physical therapist is like, let's double the load on the stack. Take a breath and say, hey, let me go slow. This is baby tissue that I'm growing, and it takes time. It really takes time. It's like a baby isn't made in a week.
Right. Right. That's a good point. Like, 9 months of growth. How do you expect that to happen inside your body in a week? That's a
I have an analogy I say all the time. I say, hey, if you want to know whether or not you should do something for the first 3 months, ask yourself if you would do it with a 3-month-old baby. And everyone laughs, but I'm pretty serious about it.
That's a pretty good way to see that.
Can I drink a bottle of wine a night? Would you have a 3-month-old baby drink a bottle of wine? No. Can I go back to benching 250 pounds? Would you have a 3-month-old baby bench? Can I clean out my garage? Would you have a 3-month-old baby clean out my garage? Can I go on a 5-mile hike? Would I have a 3-month-old baby? It works pretty damn good.
Yes.
Right. But people don't use it. They think I'm just joking.
That's actually probably one of the best things I might just introduce when patients are on the table. That's a easy way to see it, because they can internalize, they can visualize that.
Oh, you think it works?
Yeah.
I'm not saying it works at all. I'm just
saying
throw it out there.
I mean, that's a beautiful way to say that. I spoke to the docs, and they said, honestly, if it takes 9 months for a baby to develop from like fetus all the way through, how do you expect this truly to work the miracles that you expect in a week? It's just not possible. Now, it might not take 9 months. It might actually, depending on your data.
We've been trained by the programming of pharmaceuticals to, get shot, feel better.
Right.
And as Americans, we want everything
immediate
fast,
gratification.
As fast as scroll, right. Dopamine.
Right.
And I tell people all the time, I said, please put yourself in the mindset of, are you willing to give up swinging the golf club for 3 months?
Right.
Give me 3 months.
That's expectations.
So that your swing will be better for 10 or 15 years. Can you do that?
Yeah.
If you can't, let me just give you your money back and go home. I give people refunds all the time if I think they have if they have like crazy expectations and they feel like someone guaranteed them something. I said, listen, there's no guarantees.
Yeah.
For some people, this does not work. The only thing that works for everyone is if you stop breathing, you die. Right. I used to say everyone had to pay taxes, but certain people with last names, they don't have to pay taxes anymore. Please adopt me. So I will. Yeah. If someone comes down and there's like, no one told me it was gonna hurt. I was guaranteed this is gonna work. I thought I was gonna be back on the mat in 10 days. Yeah. I said, listen, let me just give you your money back right now. I'll send you home, and because that's not gonna happen, and there is no guarantee.
Yeah. No, that's fair. No, I appreciate that. Yeah, I didn't know how many times your phone rang going into the CPI, so I won't put myself completely out there.
I'm just saying, 40 times 4, that's 120. I've already treated probably 2,000 patients. Only half of them watch this. That's 1,000 plus another 120 phone calls a week. I don't want to kill you. You know what I mean? Like,
fair. Yeah. So
we get 2,000 to 3,000 phone calls a week for treatment.
Yeah, let's not put that out there. We won't answer any of those calls or emails. Yeah.
Can we have your personal cell phone number, please, doctor?
No, and thank you guys. I really appreciate your time. I know you guys are doing amazing things. I just want to share it with the world and really help other people. I think the ratios, they could be 50-50 in terms of how important is the stem cell, how important is the rehab. In either case, it's a large percent, and we have a big role to play. And the role that we're currently playing is we don't know what to do, so we push them, we add more stress, and we flare them up. I think that if we just understand the cruise control a little bit, don't flare them up. You have a baby growing in there, little baby cells growing in there. Your job here is not to drink the wine in the first 3 months. It's to really allow that healing to happen, maximize the healing time, and just allow them to have a little bit of freedom and independence in their own recovery. Because you're right, if they say the physical therapist is gonna push me, they have to have their own independence to be able to say, like, that doesn't seem right with what I've read and what I've seen. And we don't have to just listen to the doctor. You said it before, we're partners in this. Yeah, I chose to have this procedure, and I selected you, physical therapist. So therefore, I'm going to use your knowledge to make the best decision for myself, especially when that physical therapist doesn't know what to do. Now it's a partnership. Versus healthcare, it's like doctor, patient. in a lot of things that we do, the reason why we get the outcomes we want is because we're partnering with people. I get you want to do that. I'm going to barter with you. I get it. You don't want to golf. You want to golf next month. How about we golf in 4 months? Because you're not willing to sacrifice that. If you can wait 3 months, I can promise you, you're going to have better outcomes at 10. So the physical therapists out there, work on partnering with your patients. This is not top-down approach. That's pretty old school, especially when somebody's selected to have this procedure. You're not telling them what to do. You're helping them get to where they want. That is a big takeaway. So I appreciate you guys' time. Anything to say to physical therapists out there before we head out there? What would you tell them?
Thanks for taking care of my patients. You know, do the best that you can with them. Feel free. You know, anyone can contact our aftercare department who's a physical therapist, and we'll do our best. I think this podcast was an excellent idea. Thank you for making the time, coming all the way down to Tijuana. I'm happy you didn't get kidnapped or beheaded.
I have to drive home.
Happy to take you out some of the best tacos you've ever had anywhere on this planet. And and thank you guys, Sports Performance, for what you've done. You've done for me. Your team really is awesome. It took Dom twisting my arm a little bit to get me to come see you guys, because I had done so much physical therapy and none of it was successful. And I bring you guys up every week. I come in and I do a little bit of a Q&A with the patients, and I explain my process and my experience with you guys. When I blew out my knee, grade 2 meniscus tear, 50% PCL, and I went in to see you guys, I remember, I think I only went like every 2 weeks because I was crazy busy, but I was doing my exercises at home. You guys gave me the rubber band, which was super cool. Yeah, I have to go to buy one, that physical therapist, if you don't give your patients the tools, like for me, I probably never would have got one if you guys didn't say, hey, this is part of the deal. I'm just that busy and that stupid. But, I think that, you guys took the time, because my knee did I remember one time, one of your therapists over there was like, this is probably like my 3rd or 4th visit, pulling on my knee. And they were like, I never seen a knee tighten up this fast. Like, this is crazy. You know what I mean? And I was super happy with the results that I was getting from doing that. And so having them, like, they noticed it. Right. They remembered me from all the different, I'm a little bit memorable maybe, but, all of the different times. And for them to, actually, and maybe you guys keep notes, or I don't know how it works, but to notice the difference that in just 2 months, where my knee was sliding so far forward before, if I held my leg up like this, it just dangled, that tightening up, that type of attention to detail, physical therapists, it's what we all want. It's what every one of your patients wants. And, Lola and I, we didn't get into this for any other reason, is that, we saw people get better. We wanted to get better. And I want every one of my patients, not just my patients, there's lots of great stem cell places out there. We're not the only one. There's tons of places doing good work. And this is the next generation of medicine. So get ready for it now, because it's coming. If you want to be ahead of the game, there's going to be a day where stem cells is the first line of option before surgery.
That's a good point, actually.
Yeah. Well, we talked about that on our call, and setting this up, is that it's inevitable that this is the future of medicine. So for our patients to have partners on their journey, because it is such an integral part of healing, it's amazing. And the worst thing for a patient after, coming down here, having amazing result, and knowing that physical therapy is an important part, and then going to a physical therapist wherever they are, and the physical therapist not being open-minded and being like, I don't know what this is. I don't know what you got done. I need the order. I need the thing. I don't know how to work with this. I won't work with this. And kind of rejecting the patient because they're not familiar. And instead of educating themselves and being open-minded more than anything else, and seeing the future of where medicine is going, that's discouraging to somebody on the healing journey. Of course, we always are in touch, and we just say, just find a new physical therapist. And they always do, and they find the right person for them. If you're a physical therapist listening to this, open your mind. the world is moving and the medicine is moving at a fast pace. So be like Dr. Chris.
No, I appreciate you guys' time. Thank you to the listeners for being part of this. The thing I can walk away with is this is the future. This is a big part of what will be seen anyways. So either you stay ahead of it or you wait till it hits you and you don't know how to manage these patients. And when you push patients away, we've all had that feeling. When somebody leaves you, that's a horrible feeling. You're like, I could have done better. And I'm telling you right now, these patients want the best. And if you want to be the best and stay ahead of that and stay on the top line of healthcare, you need to stay in touch with where we're going with stem cell treatment. So thank you, everyone, for being on the podcast. And we'll see you guys on the next episode. Take care.
Thank you.
Thank you.